Hi, it's Dr. Arlene Diamco, the MultiDimensional MD. My mission is to help bring back the intuitive aspects of health back to medicine in practical and tangible ways so that you can access deeper healing and experience more peace, love, and joy in your everyday lives. So every week, as usual, I sit and meditate and I listen to spirit, I listen to the stillness, the oneness, as to what to talk about. And so today I was called to record in this beautiful setting. So I have this mountain lake behind me. I'm sitting on a mountain. I got the forest around me. I have the gentle breeze. I have this morning sun. And I was called to share with you part of my upcoming book. And this is actually jumping to the end, chapter 11, on multidimensional medicine, because this is my dream for healthcare, for medicine. It's what it could look like. And there are aspects of it that I feel like could come really easily to us. We have so many tools available, and it's really our approach and perspective of how we're doing things right now. So I'm going to share with you some concepts that I brought up in this chapter, I'm going to bring up. And then at the end, I'm going to share with you some ways to look for, to choose a physician or a healthcare practitioner, what qualities that you're looking for. So really, the first thing is to realize that around the 16th to 17th century, there was an artificial split in health, what we considered health. So medicine took care of the body, the physical, and what was considered healthcare, even though we're not just physical, we are these whole beings, like body, mind, and spirit. So if you separate it, it's not quite right. And then psychology took care of the mind and emotions. Those were kind of lumped together. And then religion took care of spirit. And so you had this artificial split of what was health. They were in separate categories, and they didn't necessarily collaborate or work together. And this is not who we are. We were never meant to be separated like that. And so to be able to access real healing, deeper healing, it's about reintegrating those things, like bringing them back together, attuning them so that they are in harmony and balance with each other. And it's not that science is incorrect. It's that our understanding of science is incomplete, because the universe is so massive and we're just not going to know it all right now. And so we have to approach the body, the mind, and spirit with that understanding that our knowledge is incomplete. And we have to approach science with the respect and knowing that our understanding is incomplete. So I use the term multidimensional medicine to emphasize the many dimensions of our being and how expanding those perspectives will include our intuition and that inner spark of guidance that's within you, your body, your mind, and your spirit. And that's always supportive and loving and encouraging and guiding. And deep, 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 deep down, your body knows how to heal. You know how to heal. And so it's really knowing how to start. And so how do we approach this? I'm going to read to you this excerpt from here, and it says, all healing begins with love. And my book's still being in the process of editing, so it might change a little bit along the way, but I'm going to read this to you. All healing begins with love. All healing has one source, because all healing is love. When you love, you also remember that you are love. The more you love yourself, the more you understand yourself, and the more vibrant and alive your being feels. That magnificent vibration of love emanates outwards, all around you like a wave. Those love waves influence other people, helping them heal as well. And that's how I feel in my practice. I couldn't help people the way I do unless I love them. When you love yourself and you love another being, it's much easier for you to understand the other. You have a heart connection, which helps you to expand on what you're able to perceive. I feel that it's my job as a physician to see that light and love within you, your true source of health. Regardless of your walk of life, where you come from, what you've done, I know that there is a light of life that cannot be undone. It's that part of you that will continue even after the physical. Yes, sometimes it may feel covered up. That's when you don't feel quite right. You have symptoms of illness or something feels off. But the light is there even if you can't see it. I love to help people see their own light and to help them align with their light and realize their limitless potential of source from love and oneness. I remember in my early years in practice, I saw a mom named Emily in the waiting room. She was distraught because her daughter was having an allergic reaction to dairy and had not eaten any. The reaction was simply from contact with dairy. She had tears in her eyes from the stress and worry of it. And I guess the concern of my face must have matched hers. I wasn't aware of what my face looked like. It's the sound of the train. But I did remember staying present and connected with her as she told me the story. Emily told me she was so touched by my response because it was the most she felt that a physician cared about her child and their experience. And that struck me because it didn't feel like I had done anything. I realized that before doing anything, all healing must begin with love. Then the process of helping is an expression of that love. So then I go into another story I was talking about from the beginning. So that all healing begins with love. That helps to guide you. So when you feel stuck and need to make decisions, it helps to guide you so that decisions are love-based instead of fear-based. And other physicians will ask, because I'm at a medical conference right now, and I did hear people ask, like, well, how do you ask each other, like, how do you deal with those kinds of patients that are so difficult, or they don't seem quite right in the head, and really it's realizing that, well, they're hurting, and it is our job to help them. And if we can see that they have this light within them, if we can see the light within us, it's easier to see the light within someone else. And if we can understand our own emotions, our pain, then it's easier to understand someone else's and to have compassion. So yes, all healing must begin with love. And then that goes into creating a culture of compassion and kindness, because medical training can be really rough. And I remember times in medical school and in my residency, we would be on call, so you would work more than 24 hours straight. And sometimes in the call rooms, I mean, you would just be trying to get any kind of sleep you could, even an hour, even 30 minutes, 20 minutes. But in the call rooms, in both those hospitals I worked in, often the sheets weren't cleaned, or maybe the mattress didn't even have a sheet on it, and you could tell because they were all messed up. You didn't have clean pillowcases, and so it was just interesting because it didn't feel humane, and then you're expected to be able to access your humanity while you're not being treated humanely, and you're overtired and overworked. So it's an interesting way to train physicians, because you're not caring for them in a way that is compassionate and kind. And so just doing simple things or providing kindness would really help so much in training. And then that could be carried forth. And remember, it ripples out in waves around you. So kindness and happiness go hand in hand. When you're kind to people, you're happier. And when you are happy, you're kinder to people. And acts of kindness also affect the chemical and hormone production in the body. It can boost oxytocin, substance P, which is this endorphin-like chemical that decreases pain, increased dopamine, neurotransmitter of joy, and serotonin, this feel-good neurotransmitter. So there are so many reasons. This is rooted in science, and so we need to be accessing all of our understanding and not just be picking and choosing what to incorporate into medicine or not. So and this speaks to the to practitioners and physicians. It's heal or heal thyself, because it's difficult to expand and have understanding of other people when you're not really taking steps to understand yourself. So it will create this block for you as a practitioner to understanding your patients. So always like heal or heal thyself, and that's part of what I was talking about. And you know, they've had studies on this, and I mean, there's so much burnout even before the pandemic, but then during and after the pandemic, there's a 2022 study published in the Mayo Clinic Proceedings that said that physician burnout had reached an all-time high of 63%, which was consistent across specialties. So we're kind of hitting that point where it's no longer getting sustainable. I mean, if your healthcare workers are not feeling healthy, then how is that a sustainable healthcare? How is that sustainable medicine? And the next point is that there is enough for everyone. So doing more with less. And doing more with less is a design slogan for the inventor and architect Buckminster Fuller. He was so ahead of his time. He used to refer to the Earth as spaceship Earth because we have a certain amount of resources allocated, and it's being able to use them efficiently so that we can take care of all the beings on the Earth. And so to consider how can we do more with less. And I like to think about that in healthcare too, because we have so many tools available to us, but we're not using them all. I mean, I think about when I was in residency, and then when I started doing yoga and meditation, and I thought, you could teach people this, and then it would be free. They would just need themselves. And for me, it had helped my digestion, it helped my mind, it helped my flexibility, it helped my focus. So it helped me in so many different ways. And I thought, I was like, gosh, you don't even have to use like other resources for this. It wasn't like a technological thing, or it wasn't a prescription for a medicine that was really expensive. It was something that was within everybody. So I was like, why aren't we actually tapping into that more? So it's really shifting that focus from this disease-focused model to a health-focused model, because regular medicine is really good at trying to put out the fires, but it waits a really long time to see like more obvious signs or symptoms, or when you're really getting into trouble, versus those simmering, smoldering signs. And people will feel those things, because they'll come in and say, I don't feel well, and they'll get checked out and say, oh, look good to me, nothing's wrong. But you will know, because you won't feel quite right. You will feel off balance. You won't feel as happy as you feel like you could. You won't feel creative, and you'll feel kind of stiff in your body. So many different ways to have those signs. And if you focus more on a health-focused approach, then see, we're more on the front end. We're not waiting for this ginormous fire to take over, and then take the fire extinguisher and say steroids and really shoot it all out, and then you leave a big mess that you have to clean up too. So instead, starting on the front end, say with encouraging an alkaline diet. And they've done studies on this too. Tufts University did a study so this is a quote from an article here. So when the researchers ran their model with a prescription for fruits and vegetables, they estimated that 1.93 million cardiovascular events would be prevented, and $39.7 billion would be saved. When they ran it with the broader prescription for healthy foods, they estimated that 3.28 million cardiovascular events and 120,000 diabetes cases would be avoided, and 100.2 billion would be saved. So there is enough for everyone if we create a system with that in mind. We can do more with less. So that takes me to how to look for a health-focused, multidimensional, integrative, and holistic physician, or another kind of healthcare practitioner. So Every person is unique, every practitioner is unique, and there's lots of variables when deciding who to go see. So there's no one practitioner with the exact same experience and training as another. So here are some points to consider. 1, character. Is the physician warm, kind, and compassionate? Do you feel at ease speaking with them? Do they have a non-judgmental presence? Are they leading by example and taking steps towards their own self-care? Do they love easily? Do you feel safe sharing vulnerable information with them? 2, knowledge and experience. Does the physician seem to have a foundational knowledge of nutrition? Have they sought out further training in integrative or holistic studies? Do they give suggestions that extend beyond prescriptions and supplements? Are they willing to investigate the least invasive options first? 3, willingness to collaborate. Is the physician willing to collaborate with other healthcare professionals? Are they willing to partner with you? Do they listen to your ideas? Do you feel you can ask your questions easily? 4, honesty. Are they willing to say, I don't know, when they are unsure? Do they have enough self-awareness to realize the limits of their knowledge and experience? Do they have an air of transparency? 5, curiosity. Do they show interest in amazing stories of healing? Are they a forever student and always willing to learn and grow? Are they willing to research extraordinary results in addition to the more difficult cases? And this is about that raising the bar of medicine, where looking at the miraculous cases, not just tossing those out as a coincidence, but really looking at those and studying why, how did they happen, what aspects of those created this so-called miracle, because a miracle is just something we don't understand yet. Growth mindset, we don't understand it yet, but we can. So 6, believes in you. Does the physician believe in you and your ability to love and be loved? Do you feel they care about you? Can they see the light of health in you? 7, where to look. So there's many different places, but a few of them that I will use are Andrew Weil Center for Integrative Medicine at the University of Arizona. This is my alma mater. I'm a graduate of their Integrative Medicine Fellowship. And so, according to Dr. Andrew Weil, who's often known as the father of integrative medicine, he says, this is the definition of integrative medicine. Integrative medicine is a healing-oriented medicine that takes account of the whole person, including all aspects of lifestyle. It emphasizes the therapeutic relationship between practitioner and patient, is informed by evidence, and makes use of all appropriate therapies. So you can find more about them at integrativemedicine.arizona.edu. And then I'll share with you the organizations that I'm part of. The Osteopathic Cranial Academy. So Osteopathic Cranial Academy is near and dear to my heart. I've been a part of the organization since 2008 and also a faculty member. So Dr. Weil is a huge fan of osteopathy in general, as was Edgar Casey. And the father of osteopathy, Dr. A.T. Still, said, to find health should be the object of the doctor. Anyone can find disease. Don't you love that? It's like, well, anyone can see, what's wrong with you, but can you see what is healthy about you? And can you help expand that and draw that out? I love osteopathy. It helps to restore that natural flow and balance, the rhythmic balance interchange there. So you can find a cranial osteopath at cranialacademy.org and click on Find a Physician. There's also the Academy of Integrative Health and Medicine, and AIHM is an interprofessional community of healthcare providers, researchers, and academics united by the shared value of treating the whole person, mind, body, spirit, community, and planet. And it's an organization that unifies the diverse voices of traditional, complementary, and integrative health. So you can find an AIHM provider at AIHM.org. nanotechnology.org and then click on Find a Provider. So there's also other ways. So I just mentioned a few here. If you can't find a physician with all of those qualities, it's okay. Just do your best. Everyone, practitioners are human too. So consider supplementing visits with your regular physician with other healthcare practitioners, such as functional medicine practitioners. You can look at IFM, Institute for Functional Medicine, naturopaths, homeopaths, holistic nurses, trained herbalists, acupuncturists, traditional Chinese medicine professionals, Ayurvedic practitioners, energy medicine practitioners, chiropractors, there's the train again, and other body workers. So, and then just a note that how non-medical professions are regulated will vary per state and country, and there can be a wide variety. And all practitioners, and even those practicing the same modality, because we're all different people. We're all unique, just as all of you are all unique and beautiful and wonderful. So just listen to your intuition when choosing. And I hope that you enjoyed this summary. And this is a new wave of medicine. It is a natural form of medicine. It is reflective of who we are as beings, as sourced from that stillness, oneness. So we can dream up this new medicine together, and that's guided by love and compassion. And that way, more people can access deeper healing with fewer resources. So doing more with less. It is possible. So just to recap all of this, 1, we can reintegrate the mind, body, and spirit into healthcare. 2, all healing begins with love. I don't know how loud that is to you, but that's the train, and I can't hear very much. 3, to change healthcare, we need to prioritize a medical culture of love and kindness. 4, healer, heal thyself. It is essential for healthcare professionals to also practice self-care. 5, there is enough for everyone. As Buckminster Fuller said, let's design with the intention of doing more with less. 6, let's shift from a disease-focused to health-focused approach to medicine. And 7, to look for a health-focused physician, consider their character, knowledge, and experience, willingness to collaborate, honesty and curiosity, and whether they believe in you. So, love all of you so much. I hope you enjoyed that. This was the last chapter of my book, which is more of the culmination of it. But the rest of the book is on embracing that inner light within you and how to access your intuition of body, mind, spirit, how to first ground your body, how to ground your mind, how to ground your spirit, what that means, and then how to access that healing light and love within you. And it has so many practical exercises that you can open up. You can literally flip to any page and pick it. And the feedback that I've gotten so far from the beta readers is really been so amazing. We appreciate everyone that's helped with that. And it's what I've been told is just that the information is really accessible. It helps you feel good. So it feels good to read it, and very empowering because you feel like that you have steps that you can take and they're more tangible. And so you can feel like that inner light within you is so much more accessible, and it's always there. So lots of love to all of you. If you would like to connect with me further, you can on Instagram at All Worlds Health, on Facebook at All Worlds Health and Pediatrics, on my website, allworldshealth.com, and you can sign up for my e-love letters. I put them out once a week on Wednesdays, and I'll see you next week on another episode of the MultiDimensional MD on YouTube, midday on Wednesdays Eastern Time. And if you haven't already, please like and subscribe, share away, and I would love to always hear from you. You can always drop a note in the comments and I'll reply to it. So have a beautiful rest of your week. I believe in you, so I hope that you believe in you too. And I'll see you next time. Take care.